Hello and a warm welcome to all of you for the third episode of Living Room Conclave on Full-Time Specialist System as a part of the India Health Mission series. Now, healthcare delivery models in India for a long time have been looked at as the amount of time that doctors dedicate to patients inside a hospital. Now, in a traditional part-time specialist model, doctors can act as consultants for more than one hospital and also manage patients in their own clinic. However, the pandemic has changed things and hospitals need more doctors than ever before, where doctors can contribute their entire working hours to a single hospital. This has triggered the implementation of a new care model better known as Full-Time Specialist System or the FTSS model, which is being adopted by many renowned hospitals in the country. Now, dedicated to make the nation aware of the new developments in the Indian healthcare space, Times Network, along with a panel of experts today, will delve deeper into the benefits of the FTSS system to patients, like how it is different from previous care models and what scope it has for the development of and the evolution of healthcare delivery in India. Allow me to introduce my guests. We have Dr. Santosh Shetty, CEO and ED at Kokilaben Ambani Hospital, Dr. H. Sudarshan Balal, Chairman, Manipal Hospitals, and Dr. Naresh Trehan, Chairman and MD, Medanta, the Medicity. Gentlemen, thank you so much for joining me here today. Dr. Shetty, I'll start off with you. How does the subspeciality and multidisciplinary approach benefit patients and hospitals during medical emergencies? How does this work? I mean, how is this a win-win for all?
So as you are aware, life expectancy is going up, and as people are beginning to live longer, they are suffering from multiple ailments. Whenever any patient comes into a hospital today, he is not suffering from one sickness. Very often he is suffering from more than one. If there's a cardiac issue, along with that there could be diabetes, there could be some other associated comorbidities. This is when a multidisciplinary approach is very, very crucial, because you have to have consultants across various specialties giving their opinions. While one single person is overlooking the patient, he needs opinions of multiple other specialists. This is when a multidisciplinary approach plays a very key role, and availability of all these consultants under one roof ensures that everyone is available at a very short notice, and we are able to see patients quickly, get to a diagnosis quickly, and then provide treatment quickly. This is especially so in very critical patients, in patients who require a lot more specialists like transplant patients, high-end cardiac patients. So overall, a multidisciplinary approach is very, very crucial, and it's becoming critical with every coming day.
Absolutely, Dr. Shetty. Very important point. Dr. Trehan, I'll take this ahead to you. You know, sir, another advantage of the full-time model is the availability of sound specialist system in different medical departments, just like Dr. Shetty was saying. How do you see this system evolving and being adopted in Indian hospitals, benefiting the patients who get admitted for complex diseases?
And there are several parts to it. One is the fact that you are available to the patient. Your own whole concentration is towards the betterment of your department in the hospital. So you develop it further and further because you have a stake in the hospital. This whole thing of visiting doctor, referring doctor, all this breeds all sorts of unhealthy practices. So I think that it is imperative that if you're going to have a high quality institution, then there is no other alternative but to have full-time faculty that actually devotes not only its full time over there and be easily or readily available to the patients, but also build teams so that high quality 24-hour coverage is available, and they are available anytime that they need to see somebody serious. So to me, there's a no-brainer.
Very well put, sir. Absolutely on point. Dr. Balal, coming to you. Sir, you know, if we compare it to the part-time model, how's the implementation of the full-time model in a hospital like yours? How does it ensure evidence-based care and the treatment protocols in tune with the latest practices in leading global institutions? So how does this help India raise its standard of healthcare?
I think we have been strong proponents of full-time models for consultants, because we believe that a consultant who's full-time contributes the most, is available around the clock, and gives the best care to the patient. A part-time consultant may be going to 20 different hospitals which are at different corners of the city and sometimes not reachable on time. So we have traditionally encouraged, and by and large, most of our hospitals have multidisciplinary hospitals with the full-time consultants. This also brings in, as Dr. Trehan had mentioned, their contribution to the development of the department, because they will be committed to the department that they develop. And we also strongly believe that education in the form of training fellows can best happen if you have full-time consultants in a given hospital. And it's very important to have trainees who are full-time, because consultants will not be with the patient throughout the day and night. And it is the trainees who are specialized in the field, or who are training to be specialized in the field, who will be available around the clock. So all in all, it's a win-win situation. And I think all hospitals should encourage a full-time model, because that is the model that will give the best to the patients who are being treated in that hospital.
Very important point, sir, that you said about the trainees, the next not the next generation, but the next set of doctors that would be coming into full-time practicing. It's important for them also to have full-time doctors in the hospital. Dr. Shetty, so we've spoken from the point of view of the hospital, we've spoken about doctors, we've spoken about trainee doctors. Let's come to the most important person, the patient. What's been your observation when it comes to doctors' availability for patients at the Kokilaben Ambani Hospital in Mumbai? How does it contribute to patient safety and positive outcomes for them?
So when we began this hospital, one of the visions that we had was that we wanted to make this as an institute, not just any other hospital. And when we talk of institute, we talk of clinical excellence, we talk of academics, and we talk of research. This blend is extremely critical for the patient. The full-time system is truly a very patient-centric system, because availability of doctors round the clock ensures that patient gets to meet the right doctor at the right time with very minimal waiting. At the same time, he sees a specialist, a subspecialist, who's only treating these patients day in and day out. This also ensures transparency in the billing system. As Dr. Trehan mentioned, that a full-time system ensures that there are no unethical practices, because the individual is aligned to the culture of the organization. And it's only when you have somebody full-time that this helps in building a very patient-centric environment. So from a patient point of view, a full-time system ensures that there are standardized protocols, everyone follows a clinical pathway. This ensures standardized treatment and overall improves outcomes. So for the patient, I think it's a win-win situation. Imagine in a place like Mumbai, if a doctor sees you today and then he's gone out, he may take a couple of hours to come back in the traffic. So ensuring that the doctor is there in one place gives the best outcomes to patients. So overall, I think a very patient-centric model.
People waste so much time in commuting. So again, it's a doctor's time wasted in commuting where he or she could actually be helping a patient. So again, another blessing in some point of view. Dr. Trehan, one important point always comes down is to the amount of the money. What kind of investment is happening in the private healthcare market for this increased adoption of the full-time specialist system? Because obviously it's a larger sum that hospitals need to provide for. So what's your experience in that? What's your take on that, sir?
So basically, this is a big issue for us right now, because the cost of creation was always high, but now it has gone up by 1.5 times because of the input costs have increased. As you know, cement, steel, all the other inputs has increased, and the dollar has gone up to 80. So all these things put together have put a lot of stress on the healthcare system in the private sector. Now, also we know that we do want to serve as many people as possible so that we don't have to charge high fees.
Dr. Bala, one point that Dr. Trehan mentioned about the research that happens, and of course the benefit of having a full-time faculty which helps build the research, get you better innovations, better treatments. What do you think is the role of technologies and infrastructure in this implementation of the full-time model, and the future scope in regards to, again, us India being able to get world-class outcomes, world-class hospital, world-class healthcare systems?
I do agree with both the panelists that the future of healthcare in India is multi-specialty hospitals with full-time consultants and training programs. And we have to keep pace with the infrastructure and technology that's available in the rest of the world. Otherwise, we'll be left far behind. Fortunately for us, India has come a long way in the last 2 or 3 decades in the healthcare. In the olden days, if you are poor, of course, you got treated wherever you are. If you are rich, you had to go abroad for any complex heart surgery, kidney transplantation, neurosurgery, or whatever else. But now you have a hospital next door which can provide all these services. This has only happened because of large-scale investments by private healthcare sectors with the talent, infrastructure, bringing in technology. And I do believe this will only develop further if we bank on full-time consultants with their loyalty and commitment to the institution, not only to the institution in treating the patients, and also building the next generation of doctors, which is training program, which also would include research.
Dr. Shetty, I want to talk to you about one point that Dr. Trehan raised, about the fact that the fees that a patient is paying goes to the hospital, and the individual doctor doesn't need to worry about it, which is great from the point of the view of the patient, which is great for the doctor also. They don't need to worry about it. They're just focused on taking care of the patient. Your thoughts on this, and also, about, I do know that at KDAH, you have an internationally accredited and standardized care pathways that helps reduce variability, maintain consistency in the quality of patient care. So just wanting you to touch upon these 2 points as we go ahead in the discussion.
So from a full-time perspective, one of the important critical element is that we pay all the full-time doctors a minimum assured amount. So this security which is there ensures that the interaction between the doctor and the patient is not a transactional one. He's not looking at a patient as one more transaction which comes to him. The minimum assured guarantee ensures that the doctor is secure. He provides the best and the most scientific treatment to the patient, because he looks at his subspecialty. If he feels that this is a patient who can be dealt better by another subspecialty, he has no issues in referring to the other subspecialty or involving somebody else. So this is where the full-time system lends itself to a multidisciplinary approach, wherein there is transparency in billing. Everybody charges a standardized fee because the hospital decides the fee. The money is collected by the hospital and then given to the doctor. Yeah. So from that security point of view, the patient gets the best treatment at the most relevant and the most efficient cost. So this is as far as the cost part goes. As far as the standardized treatment protocols, because everyone is working in the same institute, they are all sitting in the same building, this fosters a lot of a multidisciplinary approach. Doctors sit together in groups, work out the treatment protocols, and each and every patient who comes goes through the standardized treatment protocol, because the doctor works in this institute. Every specialist is working in this institute. This lends itself to accreditation and standardization of pathways, and all national and international accreditations become so much more easier to achieve, because accreditations are only a milestone, but we have to look at the process day in and day out. And the multidisciplinary approach with a full-time system lends itself to very, very standardized pathways and protocols. So overall, clearly this is the most best way of doing things.
Very important points raised by you there, Dr. Shetty. Dr. Trehan, coming to you, sir. So I'm not going to ask you any more about why the FTSS is a good system, because you and Dr. Balal and Dr. Shetty are totally agreeing with that and have raised some very valid points about it. But then, Dr. Trehan, I'll play the devil's advocate here with you. Why is this not happening more? What are the hurdles for other hospitals to become FTSS system model followers? What are some of the main hurdles? Is it cost? Is it infrastructure? Is it doctor availability? What's your take, sir?
But if you go back in time, that was the most popular system, because there were no large hospitals where you could actually practice and have enough elbow room to be able to admit your patients, to take care of them. And there were some compulsions at that time, but this was now many, many, many years ago. It is intellectual integrity, it is professional integrity, and it is financial integrity. So unless you have all these attributes in a given individual, they are never going to be great doctors or great contributors to society. There are some compulsions, especially in smaller towns, where there, like somebody said earlier, that there is a paucity of specialists. There are small nursing homes which cannot accommodate the full work of an individual. And in those situations, there is no alternative.
No, very valid point, Dr. Trehan. I think you hit the nail on the head. Also, on one specific point that I'd like to highlight there is what you said, quality. At the end of the day, this is such a field where quality is the most important thing because, I mean, it's your health, it's your loved one's health at the end of the day. Just last few questions. Dr. Balal, I will continue playing devil's advocate with you also, sir. What would your message be to patients who would maybe, come and see this huge hospital, multi-floored hospital with state-of-the-art infrastructure, and that person is thinking, oh my God, this hospital is going to charge me, I don't know, 2x, 3x, 5x what my neighborhood doctor would charge me. What's your take on that? I'm sure this has come up to you very often, but what's your thoughts on that, Dr. Balal?
There is very heavy investment to start a hospital and to keep pace with the technology and the infrastructure that is needed to run a state-of-the-art hospital. You have to continue with the investments. And also we have to adequately compensate the talent we have. So it will not be cheap to maintain a hospital or keep high-class, high-end doctors in the situation. So obviously it will be more expensive, but you can be assured you'll get the best of care and you will have a hospital that has specialists available round the clock. You have assistants, junior doctors, trainees who are with you 24/7, and a system in place that will make sure that when you're sick, someone is besides you.
Just as we wrap up, Dr. Shetty, coming to you for the last question, just your thoughts as we wrap up this discussion, the way ahead, the future, how are you seeing the outlook?
So the future clearly, as my other co-panelists have also mentioned, is towards a full-time specialist system, because a multidisciplinary approach with dedicated doctors is going to be critical. Because as medicine evolves more and more complex conditions come in, you do require subspecialists and super specialists in each and every area working in teams. Because only then will we be able to give the best outcomes to patients. You can have wonderful infrastructure, great technology, but finally it's the brains, the dedicated team of doctors, the relevant specialists who are going to be treating the patients. So overall, I think the way forward has to be a full-time specialist system, ensuring that doctors work in multidisciplinary teams, and this will be the most patient-centric environment.
Absolutely. Very important point, those last two words, patient-centric environment. That is what, at the end of the day, should be the most important thing, and that's always at the heart of doctors and hospitals. Thank you so much, Dr. Shetty. Thank you, Dr. Trehan, and thank you, Dr. Balal, for your time, for joining us on this special edition of the Living Room Conclave India Health Mission. We've had a very interesting discussion on the full-time specialist system, and I hope you, the viewers, have taken back some very important points from our discussion today. Thank you so much for watching.